All right, here we go. Welcome back to Live with Jane and Jody on this Tuesday, June 27th. Good afternoon, everybody. It's great to see you guys. All right, turn on your cameras. Feel free to engage with us today. Of course, we're going to be recording this session. We've got some great special guests with us, and we'll be talking about the medical center operations here at Sonoran University. So a lot to look forward to. For those of you that don't know, I am Jane Voorhees, one of the admissions representatives here at Sonoran University, helping you guys get ready for a successful interview. Any questions you have, preparing your application, getting those transcripts in for us. Jody and I really want to make sure you have a great experience and are ready to join our community. A lot of folks I see coming on this call are already admitted and ready to start. So this call is really great for you because you're really going to get some good insight to the medical center that you will be working in here over the next couple of years. All right, guys. So outside of Sonoran University, I am a live entertainment junkie. I love sports. I love concerts. I love all of that good stuff. So anytime you want to chat, we can share a little story. I'm always open to it. Other than that, though, I'm helping candidates whose last names begin with the letters M through Z. Any questions you have, definitely, like I said, I'm here to support you. That's enough about me for now. I'll let my partner introduce herself.
Awesome. Welcome, everybody. Like Jane said, my name is Jody, so I am one of the other admissions reps. I work with the beginning of the alphabet, A through L. So again, we're here to support you guys on this journey and get you started. So welcome back, and we absolutely love that you're taking advantage of these Live with Jane and Jody's. A little bit about me is I'm originally from South Bend, Indiana. Been out here for the 15th was my 22nd year. Absolutely love it. Love the desert. It's a little bit toasty right now, but that's okay. I'm inside. So I've been with Sonoran / SCNM. In August, I will be celebrating my 17th year. Absolutely love what I do. I look forward to, believe it or not, I look forward to coming to work every day. I love it. And I especially love working with Jane. She's got the same mindset that I do. We want the same things, both of us, so we're both on the same page. So welcome. And this will be some great information for you guys to take notes of. So welcome.
Really well said, Jody. She's the best. She's my favorite partner. I gave all my bonus bucks to Jody. Anyhow. All right, guys. So to dive into today's topic, I kind of hinted around, we are going to really focus on the Sonoran University Medical Center here, operations, the behind the scenes, a really in-depth look from two key personnel here within our community. So the first person I would like to introduce is Dr. Blyden-Taylor. All right, give me 1 second though. I am actually missing my notes. I'm so sorry. 1 second. Chief Medical Officer, Dr. Kimberlee Blyden-Taylor. Thank you for joining us today. A little bit about her is she's originally from Toronto, Canada. I know a lot of you guys are joining us from Canada, so I think that's pretty exciting to have someone else to connect with and learn from that relocation process. Just moved here to Phoenix about 2 years ago, earned her undergraduate degree in New York City. She completed her naturopathic degree at Canadian College of Naturopathic Medicine. And then she also did a 1-year program in medical education at the Department of Family Medicine there at the University of Toronto as well. 2-year postdoc program in integrative medicine, University of Central Lancashire in the UK. How exciting is this? I love the international medicine that you are bringing right here to Sonoran University. Her hobbies consist of hiking. If you live here in Arizona, you've got to be an avid hiker, weightlifting, gardening, and she's also a musician, a flautist, and a soprano. So thank you for joining us. Anything else you would like to tell us a little bit about yourself?
Thank you for having me. Makes me sound a little ADHD. I can't sit still. Basically, always need something to do. It's been lovely being down here in Arizona for 2 years. It is toasty, but you adjust to it really quickly, surprisingly quickly. I was actually cold last winter, which was very embarrassing since I think it never gets, well, yeah, I don't know if it even got into the 40s very often.
Right. Right.
You're right, though. Like our
Awesome.
blood gets thin and suddenly we get cold.
Mhm.
Once it drops below 70, I
Yes.
definitely know
Yeah,
the feeling.
yeah.
Mhm.
Well, thank you again for joining us. All right, and our other wonderful guest, let me make sure I also get the correct title for Dr. Vazquez. I am super embarrassed that I didn't have them properly noted in my notes. So thank you for your patience. This is a long one. Dr. Joseph Vazquez is joining us. Hopefully this is still accurate, actually. Associate Dean of Clinical Education for the School of Naturopathic Medicine. Is that still the correct title? Yes, I got it. All
Yay.
right. What a big, that is a mouthful, and I'm sure there is a lot in that role. So we are looking forward to hearing from you as well as what you're contributing to our naturopathic curriculum in the program here. Dr. Vazquez is originally from New England. He lived in Chicago for 10 years. Glendale is now his home. So he also sounds like he's a little bit new to the Valley. I'm sure this heat has been a good experience for him. Let's see, got his undergraduate degree in chemistry in, it looks like in Tennessee. Graduated from NUHS in 2013 with his naturopathic doctorate degree. Also completed a master's degree in advanced clinical practice. So again, how perfect is that we have him here to help run our clinic and operations. His hobbies consist of coaching track, the youth club, staying active in the gym, and dance. So I love how we're all active. This is very fun. Thank you again for joining us. Oh wait, one other special note. He's been known to have a sweet tooth for baked goods, which led him to becoming an avid baker as well. Maybe someday we'll get some special treats.
Yes.
Thank you for joining us. Anything else you'd like to offer?
No, thank you for having me. Just like Dr. Blyden-Taylor, I am relatively new to the area. I've been at Sonoran for about 3 years now. I spent the last 10 years in Chicago, but born and raised Massachusetts. So if we're ever talking sports, and if you ever complain about losing, Boston has perfected how to lose in professional sports. With that said, though, I will reiterate it's warm here, but it's nothing for those of you that live outside of Arizona, because you have something called humidity, which does not exist here. When I actually first moved to the area, my wife and I, in the middle of summer, would go out shopping, and all the natives are hiding at home. Because they're the ones who actually can't tolerate 115-degree weather. Whereas we showed up in February, it was 80 and dry, and that was hot for us. So 80 to 120, it's hot. It doesn't matter. In Arizona, there is a nuance between 114 and 116, and no, it's just hot, and you either deal with it or not. So we're really happy to be here. It is beautiful, and I will say a little bit biased here, and I know Dr. Blyden-Taylor has her educational experience for CCNM, mine from NUHS. I had a great experience, but you chose the right one, or at least you're considering choosing the right one. I've always been admirable of Sonoran's program, and I'm very happy, very excited that I'm able to contribute to that now.
Very good.
Well said. We are happy to have you.
Awesome. Thank you. Thank you. All right. So as you guys know, I usually share a core value with you. So the core value that I picked today is, and again, core values are beliefs of our institution. So I picked, we are resilient. Sonoran University always tends to adapt to what is happening at the time. With the COVID pandemic pretty much behind us, we are now teaching more classes, if not all, and labs on campus and moving towards getting back to a norm. So that's always exciting to us, is to see more energy on campus, and you know, the liveliness of our student body is amazing. So all right.
Oh, good choice, Jody. I like that one. Good synergy. That's true.
Yes, yes. So let's just go ahead and jump right in. We're going to kind of go back with Dr. Blyden-Taylor and Dr. Vazquez. And, you know, I mean, we may ask you the same question. It doesn't matter. This is kind of laid back, and we just kind of go with the flow. So I always like to ask, I'm just always curious of the NDs that join us. How did both of you become interested in naturopathic medicine to begin with? So Dr. Blyden-Taylor, you want to start?
Yeah, sure. I can start. Um, my background was in biology and in music because truth here, I really wanted to be a professional musician or orchestral musician. And I wanted to go to Juilliard. My father said, no, get a good job first. So I found a place where I could do joint degrees. I went into biology. My father's a nuclear chemist. Yeah. But I could do a program at Manhattan School of Music at the same time because they had an exchange program. So I did that. And then, kind of trying to figure out what to do with myself. Long story short, I got pregnant eventually. And in deciding on how I was going to proceed with that in terms of healthcare, I had the fortune of never being sick a day in my life, pretty much, outside the usual childhood stuff. So going to a hospital seemed like a very weird idea to me. So I went with a midwife, and it was the most fantastic care ever. Personalized, you've got time with them. And I just thought, man, this is what I want to continue with. I'd never even heard of naturopathic medicine. So when my time with her came to an end, she pointed me to a naturopath. And, it's all those things that come together in your life, right? I had the science background, but, I didn't know that I wanted to be sitting in a lab bench because I'm not that, I like working with people. I like the psychology aspects of it. And I found the Canadian College of Naturopathic Medicine, and the rest is history. I've been if you count school, I've been in this field for almost 30 years now.
Wow.
You can absolutely make a career out of it. There is, no question about that. And there's lots of different ways to do it. I've been a faculty member. I've been in private practice. I've been in administration, loads of different things to do, just depending on interest.
Wow. I love the stories. I love the stories.
Yeah.
Thank you. All right, Dr. Vasquez, what about you?
Yeah, so I actually went to undergraduate the traditional route. I knew I wanted to be a physician for most of my life. In fact, I wanted to specialize in general surgery. I was always good with my hands, and I loved the technique of it. Most of my shadowing experience before medical school was in surgical operational rooms.
Wow.
So I actually was accepted to Virginia Tech, and I started medical school there. By the time we got to clerkship rotations, I was fortunate enough to actually start with Gen Surg. And it was everything I thought it would be. It was very cool. But I started having a little bit of a change of heart in that they were seeing so many patients, and most of the time they weren't awake. And there was very little of that doctor-patient relationship and that interaction. It was a very technical job, if you will, outside of consultation and so forth. So I at that point, I think I started shying away from the more technically driven specialties. My next rotation was actually with family med, which I fell in love with. And I was fortunate enough to rotate 2 semesters back to back in family medicine. And one thing that I noticed and was actually shared with me with most of the attendings on those rotations was the common theme of, I wish we could do more. They were limited to 20-25-minute consultations. They recognized all the social determinants and other aspects of health that they needed to address, but they just couldn't. There was a quota, there was a time limit, there were a lot of these things that they had to meet. And sometimes they would have great interactions and they'd be happy at those visits, but at the end of the day, they kind of left a little bit defeated, and you could see it in their eyes. And at that point, that's when I felt like there has to be something out there that addresses these things, and something a little bit more. So with a little investigation, that's when I found out about naturopathic medicine. and it was very much focused on comprehensive healthcare. And that's something that I've really reiterated as a faculty member, as a clinician, and now as the associate dean, is that we provide a comprehensive intake as we train high quality primary care providers. That's what we are at the end of the day. Our philosophy allows us to focus on the whole person. Our standards and education puts us in line with any other primary care provider. And that was the biggest thing. So I went to National in Chicago because it was a fairly new program, and I was a fairly new person in naturopathic medicine. So I thought it was a perfect marriage there. I fell in love with medicine. I've always loved medicine. I fell in love with the concept of it being comprehensive medicine. And I actually fell in love with the nuance of naturopathic medicine, in that, relatively speaking, it was fairly new in the modern healthcare world, even though it's been around for quite some time. And I love the idea that in order to really embrace naturopathic medicine, you have to assume leadership roles in whatever it is that you do. All opportunities exist. You just have to be willing to pave the way, because all of those roads are either non-existent or they're gravel. And that really excited me. I fell in love with teaching. I've always loved teaching. My first job was actually a tutor. And so I really embraced the higher ed component of it in medical education. That was my passion, and with my experience from the traditional medical school as well. And I love the differences. I mean, medical school is medical school. It's very cutthroat, if you will. It's look to your left, look to your right. Two of these people won't be here next semester. And with naturopathic medical students, I find that empathy is top of the list. And the focus is actually more on that foundational medicine component of it. And I think it's easier to address that as opposed to find somebody and teach them how to be empathetic with the patient. And so I feel like this is a really good opportunity for us to essentially live towards that standard. And that's why I think Sonoran has really, really high standards, because those of us in academic affairs, Dr. Blyden-Taylor, we recognize that this is standard. It is medicine. Medicine is universal. The aspects or the form of medicine that you practice will vary, but the quality and the standard has to exist. And so that's how I found myself in naturopathic medicine. I've been heading forward ever since.
Awesome.
Keep
Thank you
going.
so much.
I love it.
Wow.
I'm always so inspired. Like, just I love to hear the stories. I love what you
And then-
guys are doing, what you're changing, what you're creating, the foundations you're laying for
Yeah.
these future students here. Like, this is wonderful. So thank you for leading the way. Like you said, so many things that really inspired me. Your first job was a tutor, docere, doctor is teacher. Like, for sure, it just totally makes sense. And what was funny, the way that you said, like, anything's possible if you're willing to put in the work. That's true even just for the patient, right? Like, being a patient of naturopathic medicine, you have to do so much more work to take care of yourself too. So you guys are just completely inspiring. I love it. Thank you again for sharing and joining us today. And we're so lucky that your path has led you here. So let's talk about, now you're here. Like, all right, let's get more specific. Associate Dean, tell me more specifically, like, what is your role within our academic department, academic affairs, and the community as a whole?
Yeah, so I oversee all of the program that has to do with clinical education. So clinical courses that are leading up to your experience within the clinics, and then actual student experiences within the clinic systems as well. So I'm dealing with courses that are offered in Q1 all the way through Q15. Arguably, the bulk of my job is focusing on those clerkships, which you're assigned in your 9th quarter or equivalent moving forward. I oversee, again, all of those Clipper courses, which are the clinically driven ones, which also are in charge of those notorious milestone exams that are spread out throughout the program, that allow us to set that standard of assessment in regards to your clinical skill and competence. So that's our CPE, CEE, and our last one being the OSCE exams. So I oversee all of those components. And I also oversee, which is a little bit different in my job outside of clinical education, I oversee the partnerships and operations of our community clinics. We have 7 community clinics, which we're very proud of. And it's actually something that is very unique to Sonoran. Naturopathic medicine is big on providing healthcare to those in need, the community at large. And our sister schools also are driven by that mission. However, with the pandemic, there have been a lot of cutbacks and modifications, obviously, lack of resources or inability to access certain communities. We've been very fortunate to be able to actually grow the number of opportunities of community clinics that we have in our system. So we currently have 7, and an additional community clinic partnership that is actually overseen by another nonprofit. So we get to do that quite often, and every student is guaranteed to be assigned at least 1 community clinic rotation by their 11th quarter. So everyone gets to experience it.
Okay.
Interesting. Yeah. All right, Dr. Blyden-Taylor.
I was going to say, I guess that leads to me.
Right, here we come.
Mhm. So I am the Chief Medical Officer for Sonoran University Clinics. What a Chief Medical Officer does is a mystery to a lot of people often, but there's a lot of components to it. And I think it's a little different every place you go. One of the core, though, is what I like to call legislative compliance. So it's all the rules and regulations that surround how we practice medicine, how we keep in alignment with privacy requirements, how we keep in alignment with all the requirements around electronic medical record management. If you deal with radiation, which we do on campus, actually, we have a Center for Regenerative Medicine where we do injections. And the way you can do that injection most efficiently is by using, it's called a fluoroscopy machine, which is essentially like a video X-ray. So you're taking an X-ray of the shoulder, but it's an actual moving image. Makes it much easier to inject into that joint and know exactly where you're going. But that incorporates some radiation. So where we've got rules and guidelines from the Department of Radiation, for instance, I coordinate these things. Other things that my position does is I'll oversee all the procedures and policies that we have within the clinics, so that, for instance, if we have a medical emergency, everybody knows, everybody who's involved in that, all the way from the front desk staff to the students to the faculty, know exactly what they should be doing. So lots of standard operating procedures and policies. Somebody has to write them. I'm the lucky gal to do that. Yeah. We also have a clinical research program, which has been ongoing, but we're looking to really ramp it up within the next year with several projects on the go. So you'll see on campus, especially on the weekends, and I'm not sure about what student opportunities exist at this point, but certainly we want to integrate student opportunities into everything that we do. But the clinical research is faculty members and sometimes outside members who will run trials of, it could be a supplement, it could be an herb, it could be a procedure within the clinical environment. So we are scaling up and being very active in clinical research, in addition to the botanical and benchtop research that we do through the Rick Scalzo Center. My position also handles things like patient complaints, misconduct, faculty complaints. Everything rises to the top. I'm the person who gets to, have those phone calls when things go awry. And then I'm also the privacy officer, and I'm the safety officer for the institution. So lots and lots of different things. For me, one of the best parts of my week is that I have the opportunity to run a student rotation in the medical center as well. And you'll find that partially because we have so many different modalities, but partially because people have come through naturopathic medicine at different times and from different places, you may find that although we all are essentially married to the principles of naturopathic medicine, that the flavor of it can be very, very different. One person might be doing regenerative medicine and injection work, as I was just describing. I'm somebody who does, my focus happens to be in psychiatric and mental emotional disorders. And I do modalities. It can be any type of modality with that, whether it's acupuncture, whether it's botanical medicine, whether it's homeopathy. I have my particular therapies that I specialize in and that I like. But what I really find so much fun is that my goal is to give you as a student the opportunity to look at a case and to say, well, from what I know and from what I see, here's what I think would be the best therapy in this case. And if it's reasonable, I will always let the student proceed with how they want to proceed. Because it's that trial and error within reason, obviously, that gives you that hands-on opportunity to see the medicine in motion, in practice, based on your own decisions. And that's incredibly important. To me, that's definitely the best part of my week.
I get
Oh,
that.
exciting.
Yeah, for sure. And I know there's probably several folks on this call that would love to shadow. I've been recently trying to re-engage our student for a day or our shadowing opportunities in the clinic. And I love the student rotations in our clinic and how that small but mighty classroom, there are 10 minds thinking about that one patient in that moment of what's going to be best for that patient. Like, I love the learning opportunity. I didn't realize you were doing a student rotation. You have a busy schedule. Would you be open to shadowing on your rotations?
Oh, absolutely. The more the merrier.
We'll build that in. Great.
Wow, you both wear quite a few hats.
Yes.
Oh yeah, always. You know, it's a small community, and so you'll find that most naturopaths wear a lot of different hats. We haven't gotten to that point where we're just so specialized that we're only doing that. It's just not the case.
Yeah.
Good.
So I know a lot of students, ask this question. So they're curious as far as when do students actually start seeing patients on a shift? So how soon is that? Is that in their third year? Is that right away? What would you say, Dr. Vazquez?
So that's in quarter 9 or the equivalent of quarter 9, depending on the track year that you're on. So quarter 9 is your first experience being assigned to a clerkship and assisting with seeing patients. And the reason I use the word assisting is, again, referring to what Jane had mentioned. It's very much a team dynamic. And so there's a mixture of students who are entering clinic and students who have been there for quite some time now and are experienced with patient care. The entry-level students are essentially assisting the team, assisting those students, prepping the room, helping with scribing, and obviously adding ideas back in the classroom in regard to what are next steps, what is standard of care, and what kind of treatments can we offer and afford this patient. With that said, there are some requirements in order to graduate, if you will, to that level of being competent to see patients on a clerkship. We call these secondary competencies. And so there's a checklist, if you will, that you receive in quarter 9. And the expectation is that the quarter 9 student essentially completes that checklist by the end of the quarter, or at the very latest, early into their 10th quarter. Checklist essentially allows the student to make sure they have experience completing a script within our EHR system, ECW, being able to check out certain modality devices from our laboratory or from the front desk, being able to take vitals, things like that. Once they've completed that list, they essentially have graduated into that role of being eligible to be assigned as a primary student, overseeing patient care under the guidance of the licensed attending. So it's essentially quarter 9, which is a little bit after 2 years of being in the program and a standard 4-year track.
Gotcha. Do they get exposure in the first 2 years at all?
Absolutely.
Okay.
And that's one of the things that I really do like about this program. We have built-in clerkship posts that are throughout those first 2 years of the program. So the student will have experience on the IV suite, a student will have experience in the medicinary, in the lab. We're actually creating or hoping to create a post position at the front desk. So the student will have that experience and the appreciation that our hardworking front office staff go through and scheduling patients, checking them in, and so forth. Also prior, there is a requirement of field observation. So students essentially will elect certain clinics to go ahead and observe. Again, it's completely an observational role. The student doesn't actually engage in patient care. They are a fly on the wall, seeing how certain clinics operate. We have a list of external clinics that a student can choose from, but that list also includes on-campus rotations. In fact, 25% of the field observation rotations must be completed on site so that the student essentially is better prepared and more familiar with how we operate so that they can be successful when they get to clinic in Q9.
Very nice. Very nice. Okay. Awesome.
I love the way that
Okay.
they're prepared. Yeah, go ahead,
Yeah,
Jody.
yeah. No. I was just gonna say, as we're going through these, remember, you can unmute yourself to ask questions, or you can put the questions in the chat. So, wondering minds want to know. So, we don't have all the questions. So this is for you guys. So if you have questions, just throw them in that chat.
Yes, I was going to suggest the same thing. You guys know, don't be shy. So, preparing for clinic, like I remember I started at SDNM back in 2007. And the first time I wanted to be a patient, it was on a student rotation, and they didn't prepare them for clinic in this way. Their first day in Q3 was awkward in that clinic because they didn't have those skills and stuff. So I really love all of that training that you're getting through those first 2 years to develop your patient interaction skills, your intake process, that bedside manner, if you will, right off the bat. I love it. And I notice a difference now, obviously, when I go downstairs and I see our patients and our students and stuff.
I think there must be a huge difference. I've only been here for 2 years, but as you were speaking, I was looking back at the students on my rotation last quarter. And I actually had 2 that were Q9. We were busy enough that I had to either not take the patients, or if the Q9s wanted to be primary, gave them the chance to be primary, their work was absolutely fine. Like I had no issues with the intakes whatsoever.
Nice.
I personally don't throw every Q9 into a primary like that unless they're ready. But if they're ready and they want to try it, fantastic, because I'm always there to, make sure all the T's are crossed and the I's are dotted. But it really speaks to the difference in the training, I think, Jane,
Yeah.
from even a few years ago.
Yeah, kudos to the curriculum who restructured it there.
Yes,
They're really
absolutely.
well developed and prepared by the time they get there. So I like that a
Absolutely.
lot. Yeah, thank you so much. All right, here come these questions. This is excellent. In fact, this was going to be the next question on our list, was NCLEX 1. Do you have to pass that NCLEX 1 before you can start seeing patients in the medical center?
So that is actually tied to a requirement of our capstone course. So the particular or a specific competence requirement of that course is that the student either pass the capstone comprehensive exam that we have built out, or passes NCLEX Part 1. Obviously, we strive for both the students to pass both. In fact, within the past year and a half, the capstone exam was actually revised to better prepare the student for NCLEX 1, which I don't know if you've shared yet, Jody and Jane, but I think we're all very proud of the 95% pass rate that we had for Part 1. And so that is a requirement to move on in the program, and that happens obviously prior to Q9. So it's a little bit of a yes, a little bit of a no. We do have some students who did not pass NPLEX 1, but did pass their capstone course and therefore pass the class moving forward. So yes, you either have to pass one or the other.
Thank you for clarifying. And if they don't pass the NPLEX 1, though, they just sit for that same exam in the next 6
At the
months?
next offering, correct.
Mhm. Gotcha. All right, we have another question, actually. How would you describe the process of starting your career after graduation? How did you find your first paid position, and how long did you have to wait?
Good question.
That's a I'm laughing because I think we're going to give answers from different generations here. Nowadays, you can actually find paid positions, but when I started, there were no clinics that actually offered a paid position in a clinic. That's very different now. If you were going into private practice, basically you're going straight into something where you are either leasing a room for a set amount per month and then trying to build up your practice, or often you would have what they call a split, where I didn't have to pay for the room outright, but whatever amount of business I did that month, a certain percentage would come to me, a certain percentage would go to the clinic, which is a great way to start in your very first year, because you're not having to put money out. So it depends on your personality. I was a bit older. I was in my 30s when I finished naturopathic college. I had a kid already, so I had to make money. So it also depends on how much of a fire you have under your bum. So I got right out there before I graduated. I had walked into a clinic where the owner of the clinic, he actually had 2 locations and he was running himself ragged between the 2. So I said, that's fine, I'll take it over, not knowing what the heck I was getting myself into. And then just worked my tail off. And I think it wasn't until my second year that I missed the teaching aspect, because I've always been involved in tutoring and mentoring. And so I went and banged on the door at CCNM and said, I'd make a good supervisor. And they said, no, you wouldn't. You've only been out for a year. And I said, yes, I would. And literally it went like this for about a month. And they finally said, okay, we can't find anybody for this shift. We'll give you a try. Anyways, 25 years later, here I am. So it worked out.
It worked out.
So in my experience, is actually not too different. It was, what are you willing to do? How much work are you willing to put in? And like I said, there wasn't anything really handed out to you at that time. Now, historically, the naturopathic academic profession has had residencies for quite some time, but they have drastically changed. And to your point, Jody, we both wear very many hats. I forgot to mention, I actually oversee the residency program as well, which is an academic program within our college. And it's a passion of mine. A good percentage of my work is focused on developing that residency program. There are many residency opportunities for students. Many of our Sonoran grads actually take advantage of these residency opportunities. We've worked to create a Sonoran residency network, which is essentially a network of on-site residency positions, in addition to affiliated sites that we sponsor, mostly in the Valley, but across the country as well. Anywhere in California, we actually have some in Vermont as well. Another one ready to grow in New England.
Nice.
And so this essentially affords the student the opportunity to have a not only paid position, but a secured environment for at least 1 year where they get to practice as the primary provider. But should anything go wrong, should they have questions, should they need some support in navigating very complex patients, which is what we see a lot of in naturopathic medicine, they have their residency site director, their mentor on site helping them with that process. I am a big fan of you learn by experience. And so the patient volume, especially within our residency network, within the Sonoran Medical Center, is unmatched. And so these residents are seeing hundreds of patients a week, completing hundreds of patient charts a week, on call. It's very, very busy, involved work that either puts them in great positions to either do a second year residency with us or elsewhere, or at least highly experienced for job opportunities. And so our residents are always successful by the time they graduate from our programs. As Dr. Blyden-Taylor was saying, there's private practice, there are established practices and practice groups out there as well. But I feel like the residency programs have definitely come a long way in regards to a formalized process, formalized standard that's overseen by the CNME. And then again, I don't mean to be biased here, but Sonoran has really gone above, far and above those standards to create a very unique academic and supportive experience for our residents.
Fantastic.
Mhm.
Fantastic.
So new opportunities available to our current grads, a little bit different atmosphere than when you both graduated and what was accessible at the time. But I mean, it sounds super positive, like very enriching and thriving. Yeah.
Absolutely.
Oh, we have more questions.
Yeah. Go ahead, Jane.
What kind of patients usually come into the clinic? Do you see more patients with chronic conditions or of normal, just a cold fever?
I can answer that. I think in general, naturopaths tend to see more chronic conditions for several reasons. The model of healthcare right now really is more emergent care, acute care. And so chronic disease is something that is certainly being looked at as an area of need in the general medical system. So we tend to get a lot of that overflow, and it's something that we tend to concentrate on more, as well as the care for chronic conditions. I think we fill in a gap. The naturopathic community fills in a gap in terms of hands-on care for chronic conditions that hasn't been available to a lot of people. We will see acute conditions like colds and headaches and migraines, but one of the barriers around acute conditions is that, and this speaks a bit to my experience in the Canadian environment. Naturopathic medicine, of course, is out of pocket for most people. It's not covered by insurance. So oftentimes, until you're established with a family, you know, you might not get somebody coming in just for your average flu. But I'll tell you, once you are established with an individual, generally they like to incorporate their family care with you as well. And then you will start to see all those things. So even though, for instance, I focus on the psychiatric and the mental emotional, I also see a range of chronic conditions, and you know, my folks will come to me with everything from, you know, your general cold or migraine to whatever it is, a thyroid issue. Yeah, so wide variety for sure. There are areas that are specialized, such as cancer, that we will see as naturopaths, but that's a very specific, there's very specific training that's needed to be done to do that effectively, obviously. So you do have an opportunity to see that in the medical center, depending on what supervisors and what clerkships you're on. But outside of, you know, outside of those more involved specialized areas, you'll see a little bit of everything.
Yeah, just to piggyback on that, another factor that really plays a role is going to be legislation. and what scope is actually covered. Mind you, Arizona has the largest scope within the United States, so it affords you the opportunity to do a lot more things compared to a limited state scope. So I agree with Dr. Blyden-Taylor. Naturopathic medicine is inclined to see more chronic conditions. However, the percentage of acute care is higher in Arizona because of that larger scope and the established definition of NDs as primary care providers within the state as well. We see everything and anything. Our toolbox is extremely large as well. So again, as Dr. Blyden-Taylor said, it really depends on the attending with whom you're working in regard to what modalities they have additional expertise in and or more comfort in applying to their patients' treatment plans. On my student rotations, for example, I see a lot of phys med conditions. So when it comes to either support of elite athletes or chronic low back pain, those that are requiring soft tissue, naturopathic manipulation, I'll see a good percentage of those on my rotation as well. So I'll be seeing general medicine, chronic conditions, acute conditions, phys med conditions. And that's just the beauty of naturopathic medicine, is that you're trained, willing, and able to see all of those cases.
Right.
Thank you for sharing. Wait, this is news to me. You also have a student rotation?
I do.
Does
Wow. There goes
every
our ad
doctor
again.
here, is everybody on faculty and a doctor seeing patients? Like, I had no idea. You guys
No.
are so busy.
But I'll tell you, because both of us are so involved on a day-to-day basis with what's happening in the clinic, it makes sense to have the hands-on experience so that we can actually see the results of our, administrative decisions. It's a smart thing.
Yeah.
Fantastic.
Mm-hmm.
Wow.
I mean, it really just shows your commitment to creating that better program, just really being involved with it every time. I mean, so this next question is perfect. What would you say are the distinguishing characteristics of the clinical experience, education, training at Sonoran compared to the other naturopathic medical schools, realizing all the schools offer quality education, of course? Thank you, James. Great question.
I'll start. One thing that is different here in Arizona that I certainly experience in private practice, but not so much in the schools. Well, my only other experience in a school is in Toronto, is the fact that naturopaths can be or are primary care physicians here. In Toronto, the way naturopaths are positioned, we can act as primary care physicians, but we don't have all the tools. Very extremely limited scope for prescribing pharmaceuticals when they're necessary, and inability to order lab testing or imaging and have insurance cover it. We can order it, but you have to pay out of pocket. So here in Arizona, because we can do those two things, people will elect to have their naturopath be their primary care physician, which is a whole other level of responsibility for somebody, because now you're not as much a part of a team as leading the team of, or directing the team of healthcare providers that person has around them. I personally find that degree of trust and that degree of responsibility, so trust of the patient in me, I always find it quite an honor. And it's, I think, what elevates this from a job to, it sounds a bit cliche, but very much a calling. You're taking other people's lives in hand, and it's something that you have to embrace as a part of your entire identity. Your career as a naturopath is not just sort of over here, compartmentalized, and then I live my life over here. It's not that I let it bleed into my personal life, but it's part of my identity for sure. And that degree of trust and responsibility, to me, elevates it in that way.
Very nice.
Yeah, if I can be so frank, to answer the question, the real difference is that Sonoran has Dr. Blyden-Taylor and me, and the others don't.
There you go. There you go.
With that aside,
No,
and all
that's
joking
yeah.
aside,
Couldn't have said that better.
the biggest thing really is really going to fall back to the scope of the state as well. The CNME oversees all of the curriculum standards in regard to what it is that we need to be teaching within our program. So all the programs do that. It's how those are achieved. And a lot of times, even per Dr. Blyden-Taylor's experience, those are achieved via theory, hypotheticals, case discussions outside of the setting. Whereas in Arizona, if we want to have a conversation of what you would do in an emergent hypertensive crisis, well, class, let's take a walk to our crash cart and review what we have in our crash cart. These are the medications we have. These are the tools we would use. This is what we would do in these situations. And that's part of the standardized training, because we are actually likely to see those situations and need to be prepared to handle those situations accordingly. And that's really, again, going back to what we were talking about at the beginning of the session, which is training minimally competent, yet foundationally primary care providers. Those who are familiar with standard of care, those are familiar with administering standard of care, and those with the experience and the passion of incorporating naturopathic philosophies and modalities in that care as well. Because as you said very plainly and so beautifully, Jane, we're doctors. We're training doctors, we're graduating doctors. Patients are going to trust us and trust that we essentially were, on the administrative side, providing the best quality education to prepare these graduates, and trusting that these graduates, ex-students, took opportunities of all of the support and resources that we provided them in that time. And mind you, in the world of medicine, you never stop learning.
Right.
And so this is just the beginning. I mean, you are front loaded with all of this information, but then you continue learning for the rest of your career. And I think Sonoran is different in that, you know, our standard is quite high, and we try to put you at the most fortuitous position possible to excel, not only in your career, but in the world of medicine, to collaborate, to open the doors again, because when you graduate, you are part of our family. You represent not only the profession, but you represent our institution, our school, our name, our brand, and we're proud of that. And so we want to make sure that when you graduate happy, confident, and ready to take that knowledge to represent us in that way.
Well
Well
said.
said.
Very good. Very good. Awesome. Where are we at with the questions? And was that it, Jane?
I don't see anything else from our guests, but
Okay.
keep them coming, you guys. We got about 7 minutes left. Again, this is your time, and this is just tremendous. Like the information that we're receiving, the insight and the guidance. Like, thank you both so very much.
Yeah.
Our questions are basic, boring, operational. How many shifts does a student have per week? Like, you know, guys, you've got better questions.
I know you do. You do. Absolutely. I'm just looking over
You
our
can answer. You can
questions.
answer those operational ones, Dr. Vazquez, because I don't know how many. How many do they have a week? It's a need to know basis up here, I'll tell you.
Yeah, so early on in the quarter, quarters 9 through 12, it's 2 clinical clerkships that are assigned. You'll jump to 3 actually in your 12th quarter, then jump to 5 for the remainder of the program. Again, because it is focused on clerkship and patient experience.
Okay, good to know.
We touched on it briefly earlier. Like, what's the average size of that clinic student shift, that classroom?
So it really depends on, one, where the shift is located, and two, the amount of administrative support that rotation has. So per CNME standards, for every 1 physician, they will have no more than 6 students assigned to that shift. But because we have resident support, that number can jump to 12 when a resident is assigned to that clerkship as well. And mind you, on those busier, more populated shifts, there is support that's needed because those shifts usually see a lot of patients. And so you're not really sitting around really ever. It's always rotating through. Our community clinics may have limited amount of students assigned just because of the logistics of a confined space or BU. So some clinics might have a maximum of 4 students, no more. Or even our specialty shifts at the medical center. So our IV suite will actually max out at 6 students, even if there is a resident assigned, because of the space and the nuances of the work that goes into administering IV and parenteral therapeutics. But again, the general rule of thumb is 6 students for every attending physician.
I don't know if this is on our list at all, but you mentioned specialty. There's a few times I hear this word coming in. Is that in reference to like honors tracks? When do those come into play and how do those work?
Yeah, so the honors tracks essentially you apply in quarter 11 and start in quarter 12. These are opportunities for you, in addition to the general foundational curriculum, to also focus on certain specialized aspects of our medicine, so that you're more nuanced, more educated in those specific fields, and arguably more marketable for practices or residency opportunities that focus on those honors tracks. So currently we have a pediatric honors track, community medicine, nature cure, and our regenerative medicine track, which I will say, especially for our regenerative medicine track, the turnover is quite high in regard to those honors track students becoming regenerative medicine residents within our Sonoran program graduation. And they are very grateful for that experience that they get in the honors track because it puts them in the position to excel in the residency program.
Super. Brilliant. What do you think, Jody? What else you got?
I'm just looking here. Is there still, Dr. Vazquez, is there still a lot of telemedicine being done today? Yeah.
Absolutely. So the CNME actually has formally built into their standards that 10% of the required patient visits, 225 primary visits are required in order to graduate. 10% of those actually can be completed via telemedicine visits. Which was, again, one of the many benefits from this pandemic in regard to adapting and providing these kind of advanced learning experiences, because telemedicine is huge within healthcare and it's not going away anymore. In fact, it's developing, it's growing larger. So many of our shifts will engage at some point every quarter in some form of telemedicine.
Very good. Very good. Awesome. All right, so we have a couple more minutes left. I would like both of you to give your expertise advice as far as what advice can you give to these students who are getting ready to start, as far as you guys both being NDs already. What advice can you give them?
Maybe I'll let you go first, Dr. Vazquez, simply because there's some questions here in the chat that you could probably incorporate into that answer.
Sure. One of the biggest things for me is that this is a very exciting time for all of you, and I remember being in that position. Don't ever lose or forget that excitement and passion that you have. The biggest piece of advice that I have is converting where that passion and that energy goes. Because right now I know you're thinking about the big picture. What can I do as a physician? How can I help my community? How can I help the world? How can I improve healthcare as a whole? And that means that you take that passion and you do really well in biochemistry. You know, we have a lot of students that forget that sometimes. Because that's a necessary step of the process, that, you know, you remember why you're here, but that also means knowing what gram positive and gram negative means in micro. that also requires you to understand truly what a negative diagnostic finding means, how that applies to mechanism of actions of potential treatments. What is the pathophysiology, understanding cellular biology and physiology, and how that all plays into key. It sounds removed at first with your basic sciences, but it plays a huge role and you use it every day in practice. So don't lose that passion. In fact, refocus that passion on the classes. When the quarter is over, step back, remind yourself why you're here, and then step forward and refocus that passion on your next set of classes. That's honestly the biggest advice that I have, especially working with very dedicated students who have realized that a little later in the process, have had a little hiccups, but have been able to correct that and be very successful practitioners.
Jane and I hear that all the time. Remember the why. Right.
I
Thank
don't
you
know if
so-
we,
Yeah,
we
I know. I was
go
going to
on?
say, first of all, number one, yes, thank you for your time. I want to acknowledge that we are 1 minute over. So for those of you still sticking around, if you want to finish that last question, we definitely would love to hear your words of advice. Thank you.
And I'm so sorry, but I do have to step aside to another committee meeting. It's been nonstop since 8 this morning. So it's been a pleasure. I think I speak for myself and Dr. Blyden-Taylor. We are a very close community. We really focus on our students being successful and being well supported. So if you ever have any questions unique to our areas, not only feeling free to reach out to Jane and Jody, but even to Dr. Blyden-Taylor and myself. I'm sure Jane and Jody, you can share our contacts or email contacts in that regard. But we are always here to support our prospective students and our current students as well.
Perfect.
Thank you for your generosity,
so
your
much.
information and wisdom today. Thank you, Dr. Vazquez.
I'll add that one last thing, one last answer to that question. Be open to having your mind changed, not about naturopathic medicine, but about your ideas coming in. People come in, oftentimes thinking, I'm going to do this and this only. That may be, and you may graduate and still want to do that thing, but there are so many experiences that you will have here that you can't anticipate. And things that you'll learn where you thought, well, I knew about that, or I knew homeopathy was ridiculous. Be open to having your mind expanded. You don't have to accept or change, but the goal here is for the mind to become more flexible. I am always happy when people come out of a class. I used to run a homeopathy curriculum for the Canadian College, and they said, I thought this was all BS, but I can actually see where you're coming from now. And I think my job here has been done.
Exactly.
Keep your mind open and flexible. So many experiences that you can't anticipate will be here for you.
Good advice. Thank you
Excellent.
so much.
Thank you, Dr. Blyden-Taylor.
Awesome.
Thank you.